Okay, so pretty much this lecture is going to be devoted mostly to vision because vision very complex, and that's why we have optometrists and ophthalmologists and people who make whole livings and careers out of it. Even though we have two of these organs in our body, I mean it's very complex, especially with how light just enters your eye and how it's perceived by our brain. Now, let's talk about the very general anatomy. So what do we have superior and inferior? Well, we have things called eyelids, but the medical term for that, well, actually there's two medical terms. One of the most common medical terms is palpebra. And when you see palpebrae, it's just the plural form of palpebra. So this is a Latin origin of the word. And this part right here is what I call the palpebral fissure. And you might be like, so what is that? Basically, it's your eye slit. It's just basically the opening of your eyelids to reveal your eye underneath. Now, you might be like, isn't that pretty obvious? Well, sometimes things happen in nature and development. And there's something called, well, cryptophthalmos, and this linked to this syndrome called Fraser syndrome. And yeah, this is a woman in South Africa. I don't know if she actually got the surgery, but she was born without eyelids. And here's a picture when she was a baby. So yeah, that palpebral fissure is important. So I think they said like, in this people who have this syndrome, their eyelids might be actually fused to their eyeball, or they might have like no eyelids fissure altogether. So she's blind. She doesn't have any vision, but I think she wants cosmetic surgery, so she actually has eyelids. I didn't see anything. I have to look if she actually got the surgery. But yeah, it shows you sometimes if there's an anatomical structure, if something happens during development, that can result in abnormal formation of those structures. And yeah, and then what we have here is a layer in the inner part of your eyelids and also surround on the outer surface of your eye. So these are called conjunctiva. So the bulbar conjunctiva, these are the ones that are the layer, this pink layer that's right along your eye and outer to your eye. And the palpebral conjunctiva is right here. So it's on the inner surface. So again, is it closer to the eye or is it closer to the eyelid? If it's closer to the eye, it's the bulbar conjunctiva. If it's closer to the eyelid, it's the palpebral conjunctiva. Now, this is conjunctivitis, and ooh, gross, yeah, like look at all this, like probably some bacteria, mucus, white blood cells, and oh, all those tears. And whenever you see that suffix itis, in its proper use, it refers to inflammation of a tissue. So here we have inflammation of the conjunctiva, and what we have is conjunctivitis. I know like common use sometimes they say like senioritis, like if you're graduating and they call the condition senioritis, but that's like colloquial terms. Itis, they're saying itis is a condition, but in the medical term, properly used, itis refers to inflammation. And yeah, that's what we see. I have to look at what type of bacteria that was, but yeah, super, super nasty looking, and that's conjunctivitis, inflammation of the lining of the eyelids, or I'm pretty sure it's both bulbar and palpebral being inflamed in this example right here. Can you remember that long time ago I told you that you're learning two new languages when you're learning anatomy. You're learning both Greek and Latin, or maybe you can, or you can even say a third, two and a half language, like medical terminology. It's English, but it's kind of its own language in itself. Another term is blepharon, and it still refers to the eyelid, but palpebra is Latin, blepharon is Greek. And there's something called blepharoplasty, and this is before and after. And yeah, she probably got more than just eyelid surgery, but let's just focus on the eye. So what do we see here? Well, you might have heard like the colloquial terms or layman's terms like single and double eyelids, and you can tell with her upper eyelids, yeah, she definitely has a change in shape between her upper eyelids, right? So you notice that she has that extra crease. And yeah, this is the most common procedure. And yeah, and especially in Korea, like I guess plastic surgery isn't stigmatized or down upon as it is here and in other countries. Like it's pretty. I always remember. I think it was a Vice documentary, but they said like it's a common like sweet 16 birthday party or present for parents to pay for their daughter's plastic surgery to get double eyelids. And if you look up, like even in Japan, I think they have all They do have the surgery, but they also have these interesting thing where they put like tape in their eyelids to make a extra crease. So sometimes they like the extra cosmetic touch due to, I think they say it makes the eyes look bigger or whatnot. But she also has different makeup too. Like I think but yeah, many things you can make you do to make your eyes look bigger. Yeah, watch blepharoplasty surgery. Yeah, so if you look at it, yeah, it does kind of open up the eyes a bit. So maybe this is why some people. So this is like different types, and sometimes they actually move this fold right here, what's called the epicanthal fold, and they kind of actually make it so that this little crease goes all the way instead of this fold of skin over here. But yeah, this is why it's called blepharoplasty, and you might be like, why don't they call it palpebroplasty? I think it's because plasty comes from a Greek root, so they try to most of the time match Greek with Greek, Latin, Latin. I know it's like anatomy throw and medical miss and throws curveballs all the time like that. But sometimes you gotta know both the Greek and the Latin version of a structure. And here's Asian and Occidental. Again, this is not accidental. Occidental means Western. But what we have here is that we have the levator aponeurosis. So again, remember aponeurosis, these are connective tissues, and this is like an extension of the tendon of a muscle. Now, what we have here is that with the occidental, with someone who has double eyelids, what we see here is that we have this insertion over here. Now, over here with the Asian one, what we see is that insertion is more down here. So when this eyelid is retracted in the occidental eyelid or double eyelid, you're going to have a fold here and you're going to have a fold here. But if your insertion is all the way down here, it's just going to retract and you only have one one prominent fold. So what they do with the blepharoplasty surgery is that they try to make an additional insertion just like here in the occidental eyelid. And how do they do that? Yeah, what they do is basically put sutures. Yeah, they put this use little threads, and they basically use this, extend this aponeurosis, and make a new insertion right here. So yeah, they do have to sew things in your eyelids. Now, a good plastic surgeon will not sew your eyeball. They just want to do the eyelids. But this is what happens, and this is how they're able to do this permanent suturing and this double eyelid. Fortunately, thanks mom. If I wanted double eyelids, I already got that. Thanks to my Filipino mom. But yeah, this is why if you have an Asian, if you want this double eyelid surgery, then in the future, maybe you want to go to Gangnam or whatnot. And it's really cool. Like I think the article they also showed, like there's literally like plastic surgery is like almost like advertising Starbucks, like plastic surgery offices, walk in and you can get your double eyelid surgery during your lunch break or something. It's pretty interesting. I've never been to Korea, but I'll go there just to see like, hey, is this for real? Plastic surgery off the street? Dang.